Okay, good morning, everyone. Thank you so much for joining. So we're very happy to have this 2 years PHIRI event where we can really showcase our different activities that we've done so far. A lot of the partners all across Europe have worked really, really hard. And now is our moment that we want to show everyone what we've been doing, what we've been working on. And so today, how we will be doing that is by guiding you through the health information portal. That will be the red thread throughout our meeting today. And through that, we will move through the different sections we have on the portal, and each of our partners will explain what they've done, the activities, and showcase it through the portal. So that you can share that again with your colleagues, and we can foster population health research and policy making across Europe. So just some practicalities. This meeting is being recorded, so just please be aware of that. And also, if you have any questions at any time, just put it in the chats. My colleagues are here around the table, so we're able to follow up on the questions that are being raised. Also, as you can see next to my head, we have a PHIRI Twitter account, so tweet about today, so that we can spread all the things that we've been doing way beyond our own networks. Yeah, and then so the meeting starts now. We will be continuing until 1. We have a lot of things that we want to show you, so we have not foreseen a break, so I hope you can sit with us through this wonderful PHIRI 2-year event. And then I will dive in straight away as we have a lot of activities planned. And it is really my pleasure and honor to have Nick Merly from the Cabinet of the Minister of Public Health and Social Affairs from Belgium with us today. And he has been and still is very involved in e-health and health data for Belgium, and also with regards to the COVID-19 management. So I think he really knows what it is for people working in public health across Europe to have been very active during these challenging times. So Nick, the pleasure is mine to give you the floor. Thank you so much for being with us today.
Good morning, everyone. Thank you for offering me the possibility to address you at this event marking the 2nd anniversary of PHIRI. I would really like to congratulate every one of you with the anniversary and with your continuous effort to create the ecosystem necessary to support the use and the reuse of health data for supporting fundamental research, population management, pandemic management, policy making, and innovation across Europe. I understand that this event will focus on these achievements and outcomes of PHIRI. To set the scene, please let me repeat the key principles that Belgium wants to comply with and that are also integrated in our approach concerning an integrated health record and in our roadmap e-health and health data. These principles, which are probably quite common across all member states, are ensuring quality, continuity and safety of care, realizing citizen empowerment and access to health data and services, empower our healthcare providers in the same way with access to health data and services, facilitate the exchange of data concerning care, health and well-being, support innovation and stimulation of research and development, and support digitization and optimization of administrative processing, also in the frame of dealing with the stress and availability of the healthcare workforce. Additionally, COVID-19 has demonstrated that collaboration at the European level is fundamental. This pandemic health crisis underlined the need for data from hospitals and intensive care units, from healthcare providers, from testing activities and laboratories, and data from vaccination campaigns, so we are able to check models and assumptions. As researchers, you have shown the world your devotion to help to manage this crisis. At the same time, it offered the opportunity to have faster than normal access to data and to show what you are capable of in gathering and treating the data, and creating the analytics necessary to understand the dynamics of COVID-19 and propose proactive measures to manage the harsh situations of healthcare systems and the impacted citizens in the EU. Policymakers relied heavily on your work, and you have proven to be an essential cornerstone in health crisis management. A lot of research still has to be done to analyze the impact of the measures taken and to deduce the lessons learned necessary to do better next time, because there will be a next time. Fast availability of high-quality data is core to ensure reliable research outcomes and stable systems. This includes the real-world medical data collected routinely during primary care processes, electronic health records, as it is defined by the European Health Data Space Regulation. Researchers should benefit from a more direct way of obtaining access to data within a trusted and secure framework. It shouldn't take years to get the necessary data or access to the data to evaluate the effectiveness of new medication or active components, to analyze infectious diseases, or to get the feedback if policies concerning appropriate care, crisis management measures, or new financing models live up to the expectations. Population management should help local healthcare providers, healthcare institutions, regional and federal policymakers to focus on these measures having an actual impact, to support care, but also to support prevention, well-being, and good health of our citizens. Access to data should therefore be more efficient, less expensive. Earning the trust of the individuals is essential if access to sensible data, such as individual health data, is requested. This is a responsibility of all of us. The reason why research is performed should be clear and well communicated to the citizens and individuals concerned. If we expect data altruism from individuals, data users will also have to show data altruism and accountability. If we want consent mechanisms like opt-out to function, it has to be clear which ethical and deontological principles were considered, how research results will be used, and how individuals and healthcare providers will benefit. The what's in it for me has to be demonstrated. Registration of data by healthcare providers and individuals should be made easy with a clear return on investment and, if necessary, supported by appropriate incentives. Providing useful dashboards and individual feedback can contribute to the quality and availability of data. Research should enable us to offer the best possible healthcare at any moment in time, also during crisis situations. Of course, all privacy-respecting measures, such as anonymization, pseudonymization, and availability of legal frameworks, as requested by the GDPR, should be in place. The European Health Data Space provides a health data access body that guarantees the privacy of the concerned patients and individuals and offers the necessary data permits. Some countries already have a health data authority or agency in place which can fulfill this role. The European Health Data Space defines clear responsibilities for the health data access bodies, assuring knowledge and standardization of the data and its availability. Sometimes the quantity of data in one member state is insufficient to support the research in the treatment of rare diseases. Research concerning cancers relies heavily on genetic information. The EU 1 Million Genome Initiative will allow for research in these fields, and your work based on this data has the potential to improve disease prevention, allow for more personalized treatments, and support groundbreaking research. Also, industry, including the major players such as the pharma industry, but also the small and medium enterprises and startups, should benefit from the single data market and the available data to support research and product development. The AI Act will create a framework for trust in AI systems. These AI systems offer opportunities to share knowledge and provide decision support for policymakers, healthcare providers, and even individuals. The necessary data should be available to check and contextualize these AI models. The availability of good quality data is core for this. Health data is often distributed, or maybe scattered is a better word, not only across the different member states, but also within the member states. European health data space has the ambition to form the backbone for use and reuse of health data, consisting of rules, common standards and practices, infrastructures, and a governance framework. Initiatives such as My Health at EU and Health Data at EU aim to offer the necessary frameworks to ensure cross-border interoperability and data and health services availability. This cross-border infrastructure plays an essential role in opening up this data for primary and secondary use. Pan-European services and infrastructure that can be reused by several member states should be offered by the EU. With PHIRI, you have built a European health information portal to provide an overview of what the most important data sources are per country in public health and how you can access them. You have also contributed heavily on federated data analysis, where the data remains where it is stored and a European demand is analyzed locally and distributed afterwards. PHIRI is a trendsetter how to put this pan-European infrastructure in place and how EU member states can work together. Let me finish by wishing you all a happy second anniversary and an enjoyable session that is intended to be a celebration and acknowledgement of your work and continuous collaboration to enhance policy making and population health management across Europe. Thank you.
Thank you so much for these kind words. And indeed, I think there's a lot of work that has been done. I think we cannot agree more that it's really important to have access to data to be able to analyze what is going on in the country, analyze what is going on into the population, and to be able to adjust our policies, to be able to address the needs that we have. And having access to data is really essential in there. So thank you so much, Nick Marly, for being with us today. It's a real pleasure having you here.
You're welcome. Thank you.
Okay, so then I will move on to the health information portal. So
to the video, but I know.
Yes, so I just want to say that here you can find the health information portal. It's at healthinformationportal.eu. We will use that as our guide through the sessions today. But before we do that, I will actually give the floor to Barthélemy, who will show us a video on what we've achieved so far. Just in a couple of minutes, all our highlights are showcased. So Barthélemy, over to you. Thank you so much for this wonderful video. Thank you, Barthélemy, for having prepared that for us. I think it shows really that we've made a lot of progress. In 2 years' time, there's a lot of activities that were performed, and it's really nice seeing them just in a couple of minutes. So we'll be placing that onto our PHIRI website so everybody can watch it at their convenience. Then I will move on to the next point. So we will go to the Health Information Portal, and I would like to welcome Hanna Tulum from Finnish Institute for Health and Welfare, and has been leading our activities on Work Package 4, which is overseeing a lot of the work of the Health Information Portal. Hanna, could you maybe tell us a bit more what this Health Information Portal is?
Thanks, Petronio. The Health Information Portal is a one-stop shop. It's a gateway where you can easily find information on available health information related data throughout Europe and how to get access to that. Additional to that, there's a lot of information on capacity building, different projects, which my colleagues will be telling you more shortly after me.
Thank you. And what do you think is the added value of having such a health information portal?
Thinking as a researcher first, it's really valuable to have one place where you can find information on data, because usually, as Nick Marley said, it's scattered around the countries or even within the countries, and rather difficult for researchers to find and get access to that. So the portal will provide easy way to find out what's available. But also for the policymakers, it has a lot of information on the health information, where to find the already processed data. So also for them, it's really good starting point to find out what's happening within Europe in relation to the health information.
And how has the information on the health information portal been provided?
That's a collaborative active, so no one can do it by themselves. So we are really happy that we have our national nodes, which have been actively providing information to the portal. They are essential for the keeping information up to date and increasing the material. And Metka and others will have more details on the national nodes sorted for you.
And maybe one final question. Can we see the health information portal as a metadata catalog?
Surely. On Health Information Portal, we have been using the standardized protocols collecting the information on data sources, using the standardized metadata protocols, which is really a step forward towards the metadata catalogs we will be needing nationally for the European health data space. So countries have already done a lot of chunk of work they need for those metadata catalogs now when they've been documenting the information for the Health Information Portal.
It's really also to get countries to think about how they can make sure their data is fair and to support them in making the data reusable.
Yeah, that's really important. That for the first of all, you need to find the data. If you don't find it, it's really difficult to reuse it. And the Health Information Portal and our metadata catalog there is the first steps towards the findability and fair assessment of the data.
Excellent. Thank you so much, Hanna, for giving us broad first views on the Health Information Portal. And actually, now I really wonder, is the Health Information Portal visited? How many people actually look at the portal? Barthélemy, can you tell us maybe a bit more about that?
Yes, sure. I will give you a quick overview of the last numbers from the portal. Do you see my screen? Okay, so just starting with a global view of the last year, we have more than 6,700 visitors, which is, I think, great numbers. But if we have a closer look with a comparison from the previous period in 2021 versus November 2022, we see that the numbers of users has more than doubled. And this is due to several explanations, the promotion that we do of the portal, the increase of the number of the pages of their content on the portal, but also some technical applications to improve the search engine optimization settings, and especially the schema.org implementation.
Okay, great. Thank you so much. So basically, we can say that we've seen a really steep increase in the last couple of months. So that's really nice to see, and we will keep on going promoting the portal. And please, of course, do this among your networks as well, so that actually users from all across Europe can see what the about. So just highlighting a couple of things on the portal as well. So it starts with an about section with more information what the portal is about. Then it talks about there's a specific COVID-19 corner with rapid exchange forum information and the COVID-19 policy measures. Then you can search countries, you can search the measures, but you can also search national nodes. You can search Europe with all the different initiatives and infrastructures and also international organizations that work on health information. There's an area about training, and there's also an area about services. So, for example, just recently added is a PHIRI demonstrator. We also have a glossary with some of the main and key terms of the different activities and the different definitions that we have in the area of population health. Now we will move on to the national nodes. Maybe, Metka, can you tell us a bit more about what a national node is and why they are key for health information in Europe?
Thank you, Petronila, and good morning, everyone. Well, first, I would start with a short definition what national node in fact is. It is an organizational entity. It is usually linked to national institution, in most of the cases, National Institute of Public Health, and also some other institutes that brings together relevant national stakeholders in the country in a systematic way, which is really, really important here. Well, the relevant stakeholders are usually national public health institutes, different ministries, then national statistical offices, researchers, etc. So there are really important and basic building blocks for the whole European health information landscape, because on one hand they are developing or coordinating the development, the national health information system, and on the other hand, they can provide relevant information to other interested parties in Europe. So there are building blocks, connectors, providers, and enablers with all these functions are really important and valuable.
So can you give us maybe an example of how a country has actually made use of the portal?
Well, yes, actually, many countries provided really a lot of data about their health information sources and also about their dissemination and their national health information projects. We believe that this is very, very important, not just for them to keep this systematic, but also for other countries to have an overview what countries are doing and developing. Well, actually, and on the other hand, countries as users can find many informations on health information portal. For example, if you are interested, let's say in diabetes, you can find what health information sources are available throughout Europe, or what dissemination outputs are available in other European countries. Because earlier, before health information portal, well, you can search by Google and using different languages, but here with actually one click, you can get a lot of data.
Excellent, thank you. And what role do you think the national nodes can play in the European health data space? I mean, we've heard the European health data space already quite a lot in this meeting, and I think the European health data space will probably play a big role, but also with the activities of PHIRI are really complementing the national, the EHDS. How do you think that could work?
Yeah, well, regarding the forthcoming and many times mentioned EHDS, I believe that national nodes can play an important role. Well, in some countries, also national node coordinators or their institutions will also serve as national health data access body because they're very knowledgeable and really have a lot of information regarding their data sources. The synergies between PHIRI and EHDS are very important since the joint cooperation of national nodes and exchange of information between them is very important also for joint building of EHDS. And I would also mention the expertise of national nodes regarding data quality, strengths of indicators, and possible possibilities or different use of indicators or health data sources themselves. All this is really important for secondary use.
Yeah, I think you're really right, because what we need across Europe is not only to get access to the data, but we also need data stewards. What I mean is people who actually know how the data has been collected, what the strengths and the weaknesses are of the data. And so here, this is the type of expertise through PHIRI we can really bring together. And maybe also thinking about a crisis like the COVID-19 crisis. If you have a network that already exists, it's so much easier to, get them active, bring them together and have this trust between organizations across Europe. Do you think national nodes could play a role there as well?
Yes, sure. Well, national nodes are still main providers of information and also very important users of health information. So building these connections and cooperation, I think this is very important for the future landscape of health information in Europe and also in the possible future crisis. These connections could really make things different, as in previous crises, of course.
Thank you, Metka. Okay. What are the main roles of the national nodes within PHIRI? I mean, you've covered it a little bit. Would you like to add anything else?
I see as a very important forthcoming role the development of metadata catalogs. Partially, we already did this, but in the future, these metadata catalogs, as already mentioned, will be also very important for European health data space. So I see the most important role in the future right in this point is building the catalogs.
Yeah, and I think we'll be talking a bit more about metadata catalogs later on, and also federated analysis. And we need to build up the capacity in Belgium in Europe to be able to have the skills to do that. So I think here the national nodes can really play an important role as well. Thank you so much for sharing your views, Metka.
Thank you.
And now I will ask Miriam to join us. So Miriam has basically been doing all the operational work for PHIRI on a day-to-day basis. So I think today is really also to celebrate all her hard work. And also she has been working on the portal for quite a lot. So could you tell us a bit more on how you think the health information portal is fair and creating fair metadata catalog?
Of course, it would be my pleasure. Basically, the Health Information Portal offers an overview of key health information sources across Europe, and this was really possible thanks to the help of the national node that Metka has just mentioned. But this is, of course, a work always in progress, because every month we receive new requests for data sources to be added to the portal, and we make sure that the quality of the data that we add, it can really add some added value to the data sources. So basically, the Health Information Portal offers fair metadata catalogs, because basically the template we have created really increase the fundability, the accessibility, the interoperability, but also the reusability of the data records that we put on the Health Information Portal. And this is really a hard process and a long process, but it can be facilitated by implementing metadata standards. So this is what we have been doing on the Health Information Portal. So for this reason, we have mapped our template on data sources to DCAT and schema.org. These are two different metadata standards, and they do not duplicate each other because they complement each other. So basically, you need them both to be able to increase the interoperability, also the findability of the data. So on one side, we have DCAT that really has the power to increase the interoperability between data catalogs, and it can also allows for federated queries across different sites. And then on the other hand, we have schema.org. That basically what schema.org does, it improves the machine-to-machine communication. And just like in simpler words, it means that we are telling different data engine, for example, Google, what type of information we are providing. So we are defining for this search engine what type of information it's available on the portal. And in this way, the information we provide, it's much more findable. And this really increase the value of the data itself, because if the data can be found, if explanation is provided on how you can access the data, then you are also increasing the possibility for you reusing data. And basically, the potential for reuse of health data is immense. We just need to make sure that we can really exploit this potential, that we can make good use of this. But of course, this is also a work in progress, as we always aim to improve and to provide more information. And it's important to notice that we don't provide the data itself, but we provide you with all the information that you need to understand what is available in a country and how you can request access. For example, by providing you information on the access procedure or the contact person that you will need to get in contact with in the country itself to be able to learn more about the data or to get access to it.
Great, thank you so much for explaining that, and also explaining the role of schema.org and DCAT. I think these are elements that we need to have included in any metadata standard that we are building for the future. So I think it's really nice that, as Nick said, that we're setting a bit the stage for what is coming next. But to be able to make reuse of data and to be able to share the data across Europe, it's really important also to have good data and to have strong health information systems. So you have been assessing, together with colleagues in the PHIRI project, COVID-19 health information systems. Can you tell us more about that?
Yeah, definitely. So indeed, what we have done within PHIRI is that until now we have assessed 7 different countries across Europe to really understand how the COVID-19 health information system was organized in these different countries. So basically, what was already in place before the COVID-19 pandemic came and what had to be implemented in order to accommodate for COVID-19. Because basically, none of us and none of our system were ready to be able to handle so much data. And what we saw was that this crisis brought so much innovation across the different health information system and really brought the different health stakeholders together to be able to collaborate. Because before the crisis, the different institutes would be aware of each other, but they would collaborate less or in a less daily basis, standardized ways. But with COVID-19, they really realized that it was not possible for them to do their work or provide their information on COVID-19 unless they collaborated together. And this really sped up a lot of innovation across the countries. So we saw that perhaps the countries were not prepared, but the moment that the pandemic came, they were really they put a lot of energies to really create a system that would be able to help analyze the data. But also we saw that, for example, that they could also learn from each other countries, and this is one of the main reasons why we perform this assessment. So every time that we go in a different countries, we also have experts coming from a different country so that they can really compare and refer to their own national situation so that they can learn from each other experiences.
Thank you. And so now that these assessments have been done in quite a few European countries, are there any recommendations that you could bring forward?
Well, definitely, I think what we are now in the phases where we have learned, like we are aware of what could have been improved, but we are not at a point yet where these lessons have been assimilated in the different health information system. And what we can see now is, for example, that a lot of the COVID-19 resources, or the resources that were allocated for the management of the pandemic, are being redirected. And this is, of course, a normal way of things goes, but we really need to make sure that what we have learned, it's really implemented into the upcoming system, because we always tend to create ad hoc systems, so that a system that can react to what happens, but we need to create resilient health information systems. So basically systems that are prepared, and then of course they can learn from the specific condition of pandemic that we might be faced. But so basically some of our key recommendation is really to make sure that you don't stop your efforts now, and that you integrate what you have learned and the improvements that can be done into your own health information system. And this can range from interoperability of the health information system. For example, during the pandemic, new ad hoc health information system where infrastructures were created that have offered a lot of great capacity, but these are not interoperable with the systems that were already in place. So what now the countries also needs to work on is not creating just ad hoc solution, but to make sure that the solution that they have work in the environment of the country, so that they can connect, for example, data sets also across the country, which is still one of the main issues across Europe.
Okay, thank you. So yeah, we already have some recommendations that came out of that. What in terms of your recommendation on what should come next? Do you think this exercise, given its value, should be repeated in different settings? What are your views?
Yes, I definitely think that such an exercise can be really useful if done periodically, because you really need to become aware of, instead of only providing recommendation, you also really need to see those to be implemented in the system. But also this type of exercise, or like structure, where we first identify the stakeholders, using, in our case, the very strong PHIRI network of 41 partners across 30 countries. They really allow us to pinpoint who are the key stakeholders that played a major role in the pandemic. But so this structure, where you really find the right people, and then you interview them, and you gather the knowledge of people that have experienced the management of pandemic firsthand, this type of exercise can be transposed to different type of topic. This is also the example of the TADAS joint action towards the European Health Data Space that have also performed country visit or country assessments to see how the governance is in the preparedness of the different countries to join the European Health Data Space. And really, by using the network of a project, of a consortium, and so on, you can really identify the right people and gather the specific knowledge that you need. Especially because, sending a survey can definitely have some added value. It can be quick, it can provide some quick responses, but you will never get a full picture. By really talking to people, by really giving them the space and allowing them to explain what went well and what went not that great, you really give them a space to make them feel heard. And then you really gather the experience of how at the ground level things went in the different countries, being COVID-19, being preparedness for the European Health Data Space, being other topics that we'll be working on in the future.
So basically, we can say that through PHIRI, we've demonstrated that the methodology is actually thorough and that it brings a lot of outputs, and it allows us really to formulate recommendations on how we can make our health information systems more resilient. So we're really looking forward to how are you sharing your results?
So yeah, this is also a good point. So I would really say that now this methodology has been more consolidated. We have already performed assessment in the project that came before PHIRI, and now we will continue in PHIRI. And the main outputs are of two sorts. So one, it's that we will have for each country that we have assessed, and some of them already available on our website and the health information portal, of course, is that we provide a one-pager with an overview of the main structure structure of the data sources, the main data analysis performed, and then also the governance structure, but also the best practice and identified graphs for each country. And this is a one page that is available for anyone, and we of course promote, encourage all the countries to share them. But also what we do is that we provide a more in-depth report for the country, specific to the country, tailored to their needs, using in the form of a SWOT analysis and SMART recommendation. So SWOT would be strength, opportunity, and threats. So basically, we really divide them in these categories, and we collect all the information from the interviews to provide tailored recommendation to the different countries to make sure that the recommendation we provide are suitable or are tailored to the health information system of the specific country.
Okay, thank you so much, Miriam. And actually, I've also heard that we might be doing these assessments for HERA as well. So we look forward to these upcoming activities. Now I would like to also bring to the floor Neville Kaleya from the Ministry of Health in Malta. Neville, could you maybe tell us a bit more on what was the added value and the experience of performing such assessments, both on being on the side of the assessed country and on the side of assessing another country? You have been involved in many of the assessments. You have done 9 countries assessments in the Joint Action on Health Information. Then you've done another 7, I think, within PHIRI, and in TERAS, I think there's more or less 12 to 15 as well. So I think you're really the expert on the health information assessment. We look forward to hearing your views.
Thanks, Petronil, and congratulations to the whole team. Indeed, there's definitely value to be gained in doing both tasks, both roles, both being an assessor and being an assessed party. So as you highlighted, I've been assessing for quite some time. I must admit that I have personally learned a lot. I have absorbed a lot of best practices, which I have tried to at least discuss with colleagues and maybe implement some elements of in our practices at national level. So, I think this will probably, other assessors will echo this. We have discovered a lot. Indeed, there are so many best practices, especially in the health information field, that not even the people in the country would realize that they are best practices. And, when you would have seen several health information systems, and then you learn of a particular practice, you can actually gauge that it is definitely a good practice. So there's a lot of gain in sharing, basically, and it can make our national systems much richer simply by being able to share things, share practices between us. It also allows you to look at your own system from a helicopter view, and more objectively, I would say, because most of us work almost exclusively in the national context, in the national landscape. So you may see things through a lens which is sort of fudged by national interests. As an assessed country, on the other hand, it has helped a lot in gelling the community of stakeholders involved who might not have felt that they are part of a health information system. This has occurred, and in fact, this has occurred in TEDAS. It has occurred even more strongly in COVID, where emotions have been running high, so to say, for a long time among stakeholders. So any feeling of appreciation and acknowledgement was, more than welcome. And I think on the whole, I found a lot of cooperation actually from national stakeholders to be involved in the assessment. Also, we're very happy that PHIRI, in a way, has been the only way, really, to document what we've been doing during COVID. Because as systems are being deconstructed, as Miriam was explaining earlier, unfortunately, things have not been really well documented yet because they've been created in an emergency. So this has provided them fantastic opportunity to have our COVID health information systems actually documented for posterity for potential future pandemics as well.
Thank you so much, Neville. Okay, well then I think we will move on to the next section on the portal and the next set of activities that we have been doing with PHIRI. So I would like to now share our COVID-19 corner. So Claudia and Neville have been leading the work on organizing rapid exchange forums and to develop this COVID-19 policy measures. So as you can see, if you click here, you have the rapid exchange forum here. And Claudia in a minute will tell us much more about what this rapid exchange forum is about. And here you have the COVID-19 policy measure with all different measures that you can actually search. So you can search by country, but also search by policy measure. And then you see what the status is in the countries. So let me pass the floor now to Claudia. Can you introduce us to the rapid exchange forum and explain us why it was needed?
Thank you very much, dear Petronil. Well, the Rapid Exchange Forum, especially at the beginning of the pandemic crisis, was really one of the few spots, I think, where technical exchange took place on a quite big scope. Meaning we started very early, also together with Sano, to have a bi-weekly exchange of partners who were working together on the one hand side in other European projects, such as INFACT, but also people who were actually in charge of crisis control in their countries. Meaning not on perhaps final decision-making partners, but the advisors to the crisis response teams. Those people who were always asked for questions like, okay, everybody is spraying disinfectants in South Korea and Taiwan. Shall we do that also? Oh, we don't have the features. Shall we buy these trucks now very urgently? And very soon we were looking for, in our teams, we were looking for evidence, telling, well, this could be necessary, or we think evidence, as scarce as it is, shows that it's not necessary at the time being. So this was, if you may say so, a bit complementing to the Health Security Committee, where on a high level, decision makers met and asked this, exchange things. And sometimes immediately afterwards, people like ourselves in this group, knowledge brokers, people working at public health institutions, people working at partly at ministries themselves, like Neville, people are working in academia. So we all joined efforts to answer these questions in this rapid exchange forum. We went in a very structured format. I'm not sure if you want to, I explain that really happily, because I think our good feature was that we really from day one organized it in a very transparent manner. So meaning basically everyone was invited as long as they had something to do with this national crisis response in COVID-19. And we also did not duplicate things that were going on in parallel, like the lab people have their own exchanges and some doctors on how they'd really treat in the ICUs. We were more the people discussing, okay, so how many ICUs did you have per country? How many places for ventilation do you have? How many do you think do we need? What do your people say? Yeah? So, and do we really need to rebuild hospitals quickly? In some countries it was even a necessity to rebuild hospital wards then. So this is just to get a feeling, can I say so, what's going on in the other countries. And as we did it on a very structured way, so it was really, we are still meeting every 2 weeks, every Monday morning, 10 o'clock the same time. So, and people could bring in their questions. They could say in the beginning there was many questions. We had to do a sort of prioritization, which we do with simple vote, that we sent it out to everyone. These are the questions pending, and then we voted on them. Sometimes we could cover 2 in 1 hour because people really prepared well. So 1 week we sent out the question, people could prepare for it. The next week we had the meeting, and in the same week all the minutes and the results that were compiled were there and shared with everyone. And as Petronil showed on the health information portal, you really can find all the findings we had over the years. I think now we had the 45 45th meeting already in this series. It's online, it's searchable, and of course we're happy to add more information if you have specific questions. Yeah? So that's what guided us.
Thank you so much, Claudia. And I think it's actually really useful for researcher also if they want to look at, you know, what were some of the, I think there are nice snapshots on certain points in time as well on what situation was and what the answers were from the different countries. How did you make sure that you got such extensive results from all across Europe in such a crisis time? How was that possible?
Well, I think it's on the one hand personal networks. People also are here. We know each other for a while. You know, we have been meeting on conferences, doing projects together. But we understood very quickly that we are, can we say, the second layer, the glue that keeps all these decisions together. I think in most countries, if I realize, decision makers have changed. You know, so who didn't change the health minister in the times of Corona crisis? But people like ourselves, you know, who are in this, as I can say, the second row. We are not the ones appearing in the television, the media, most of us, but we are the ones who collect all this information, and we know who to ask. You know, that's why, and of course, it was personal engagement, and people were all concerned. I think this is, in the end, that's why this portal is so important. I think it really brings people together, and this is one of the very important pillars in all the research we do, isn't it? That we go away from evidence-based medicine and everything, of course, but still it's always good to double check how things are working in practice. Huh?
Yeah, thank you so much for sharing that, Claudia. I will keep you on the floor, but I will ask Teresa to join us because Teresa, from the perspective of Spain, has been also very active in these rapid exchange forums. So could you tell us a bit more on how you made use of that rapid exchange forum?
Good morning, Petronil, and all the attendees. Thank you for being here. In our case, working on the Carlos III Health Institute, we use this REF network, this PHIRI network, for taking certain topics about COVID-19. Okay, I began to work on PHIRI project on August 2021. And we have been collaborating with our colleagues from the Aragon Health Science Institute. And we use this, for example, in case of what to know about a specific topic that we are going to consider in another task for the project, for example, screening programs. And we launch the question to the PHIRI network, to our colleagues from REF, and we achieve all the responses for our colleagues, and we can use for future tasks and future projects.
Hey, thank you. And what are the main sources where you find the information for the rapid exchange forum questions?
The main ones was the first and the most important was the website of the Minister of Health in Spain, but we also use different medical associations and societies websites like the Spanish Pediatric Association in case of topics like children vaccination, or the Spanish Society of General Practitioners and Family, that is also for the last question related to long COVID management. Also for regarding transport and travels and mobility, and also for COVID-19 policy measures, the other part of the COVID-19 corner, we have used the official tourism website, and we have found a lot of information of there. And also specific institutions depending on the topic launched for the network, the Spanish Agency of Food Security, the National Institute for Occupational Safety and Health, and also the PubMed search, and because we have included several papers in some of the countries, some of the questions launched on the network.
And with regards to the questions, did you receive any questions from colleagues or within Spain to be addressed in this rapid exchange forum?
Not exactly from Spain, but yes, for the WHO regional office for Europe, because they are collaborating in another project that Osmo Spain with some colleagues of our team. And they were interested in, for example, in this case, in measures that quantify the current high number of COVID-19 cases. And in our center, we decided to forward this question to the PHIRI network. So we have a high response for our colleagues, and we could share the document with the collected responses with the Regional Office for Europe, exactly with the Behavioral and Insights Unit for COVID-19.
Thank you. And I see in the chat also other colleagues really supporting how the Rapid Exchange Forum has been useful. Do you have knowledge of any international organizations also that made use of the Rapid Exchange Forum?
Of course, and it was a pleasure for us and for all that collaborates and works on REF to collaborate with international organizations like the OECD. I think it was in July that they contact with Sensano, and they forward the request to the PHIRI network. They wanted to know which national policies and programs were implemented in our countries to promote physical activity and healthy nutrition in children and young people during the COVID-19 pandemic. And the information that we collect for all our European colleagues were used for drafting a chapter that was published the last week. I'm going to write the link on the chat meeting for the report of the OECD Health at a Glance Europe 2022. And it was a pleasure for us to collaborate and to gather all the responses for the collaborators.
Yeah, this is really good to hear, because the Health at a Glance, I know, is always looking for reliable sources to provide the information that they have. And actually, in a couple of minutes, we will also have Howard from ECDC here to talk on their experience. But before that, I'd like to ask you one more question. Why do you think it's important to disseminate the Rapid Exchange Forum through the Health Information Portal and potential users, also in, for example, social network? So it includes a lot of Rapid Exchange Forum topics and urgent ad hoc questions.
Yeah, we think it is a good opportunity to disseminate all the information gathered, provided by almost 30 countries through the Health Information Portal. As Hannah mentioned before, portal is used as a one-stop shop, facilitating access to population health and healthcare data. And with potential users like researchers in public health sphere, data providers, policy and decision makers, I think this is a necessary tool that collects all the information gathered in REF meetings. If you want to know about a specific topic, you only have to visit the COVID-19 corner and write on the search bar, and also the COVID-19 measures that update frequently. And as you asked me, Petronil, you can share this relevant information through social media. The last few years, as you know, have seen a burgeoning of social media such as Twitter, Facebook, LinkedIn, and newer methods of dissemination such as webinars. We have also done REF special editions with activities and expert groups that were already in place during the COVID-19 pandemic to change information. So the Health Information Portal can facilitate networking by connecting researchers, policymakers, and other stakeholders who have similar interests.
Claudia, could you maybe tell us a bit more about these Rapid Exchange Forum special editions? Like what kind of participants or guests were there to speak to us, and what did they allow us to do? Oh, you're so muted.
Sorry. Well, Petronil, we do that together with Sano, as you very well know. So we have some special occasions which would be still on the same day, so always Mondays. Also a similar time slot. Usually we start an hour earlier at 9 o'clock instead of 10, and we cover specific topics and have guest speakers, if we can say so. Usually Luis wrote it in the chat that we always have partners from Hungary and Portugal who do a brief update on all the topics we selected, what guidelines, what international information, recent publications, are available for especially these topics. But in the special refs, we go even beyond that, and usually we invite speakers, high-level speakers for specific topics. We had a very good session, for instance, on the upcoming medicines. You know, what our aim is that we are always discuss topics before that discussed in the public or in the media, you know what I mean? So we are 1 month usually earlier before it's really broadly debated. And so that we are the ones who can be perhaps asked questions also by the media, so that we know really what's the state of play. And this special, there's another one upcoming next year, but we don't have a fixed date yet, so that's why we can't put it in the chat.
Do we know what the topic will be?
Now you caught me wrong. I think, yes, we should know about it. Miriam at least should know about it.
Miriam, I'll just slide the microphone to you, Miriam.
Yes, actually, I mean, we are still discussing with our colleagues, for example, from TEDAS, the project that we mentioned before, but it will actually be on the result of the COVID-19 health information system assessments that I mentioned before, but also on the results from the TEDAS joint action. And at the same time as this exercise is also gathering more attention from the Commission or from here or from other international stakeholders, we will also try to have them as guest speakers so that we can also learn more about the assessments that are planning to have in the upcoming months and then also years.
Great. Just I'll stay on the stage, and I will now give the floor to Howard. Howard Needham works at the European Centre for Disease Prevention and Control. You have participated to the Rapid Exchange Forum. What is your take on this forum?
Morning, everybody. Thanks for the invitation. Nice to see familiar faces. Well, I think from ECDC's perspective, some of the comments and the added value that have already been identified by colleagues in this session is also relevant to ECDC, of course, from the identification of and sharing information on the current issues that are live. I think that's maybe from an ECDC's perspective a really key issue. So it's the information exchange is critical to understand what issues are really facing the member states, and of course we've got forum and Health Security Committee, for example, and other commission-led fora where those things are discussed. But it's really unique, I think, for the Rapid Exchange Forum to because of its constituent being really at the sort of health policy science interface and really operational actors in the member states, who really give great insight into really the key issues that are live and being considered and questions that are being addressed across Europe. So I think that's really a key aspect from ECDC's perspective, as well, of course, as the richness of the exchange and understanding the evidence-based and the rationale for various approaches that are taken during the pandemic. I've just been looking through the health portal actually and reminding myself of the diversity of topics that were addressed in the Rapid Exchange Forum. It's really significant, everything from addressing the variants as they've appeared, Delta, Omicron, to antigen testing, to vaccine strategies. It's been a really diverse range of topics, and I think, again, from an ECDC's perspective, getting the evidence base and the thoughts and rationale about why member states were introducing different activities at times, because we have to understand that clearly there's heterogeneity across Europe, and that's understandable. At times, I think from an ECDC perspective, it's very important to understand the rationale about why countries were acting differently, particularly for things such as cross-border travel certificates and those sort of issues, which ECDC was quite central in supporting. So, again, that the forum provided a really rich opportunity to really get an understanding of some of the differences, but also the rationale for differences, which was very helpful. Sorry, I'm wittering on. I'll stop talking now.
No, that's perfect. That's exactly what we want. Thank you so much, Howard. I know also at the ECDC at some point there was a COVID-19 measures page. How is that different? Or if you know how that's different, or could you maybe explain a bit what the role was of that? And then maybe, Claudia, if you can comment on what we provide in the portal. Thank you.
Sure. So I think in the mid of 2021, ECDC started collecting information for what became the Responses Measures Database, which was a joint activity between ECDC and the Joint Research Centre, actually. The Responses Database was housed ultimately the JRC, the Joint Research Centre, but was based on data that ECDC collected as part of its epidemic intelligence activities. So we conduct epidemic intelligence activities on a daily basis, and as part of that we were web scraping and assessing various media sources predominantly on the measures that the member states were taking to address COVID, and that all was placed into a database which is still available. Actually, it's now archived, so there's no active information gathering now. It was closed in September, but PHIRI was really important because it kind of allowed us a sort of a validation, I guess, approach, firstly, to understand that the information that were being collected by the epidemic intelligence teams, and I say, which is predominantly media based, were broadly aligned to the information that was actually being implemented, or the measures that were being implemented, excuse me, in the member states. So that was a really useful opportunity to sort of triangulate and understand if the information that was being collected was valid.
Nadia, would you like to add to that?
Thank you, Howard. Made a good frame already. I think the difference is that we are still online, that this measures page is still being monitored. In difference to the approach of ECDC and JRC, we did not aim for intelligence gathering, but let's say we relied on our experts. So we had devoted experts. Hannah mentioned that people from the national nodes in the Health Information Portal, partners also in the Rapid Exchange Forum, and they were always invited and reminded to update the information for their countries. We understand it's perhaps not the same information status for all the countries, but we added the data there, so it's clearly visible when it was last changed. And it's still a very good overview on what's ongoing. And the good news is that if something is happening, we can immediately flag where changes perhaps are in, new travel restrictions or whatsoever. And you can search for different terms or look for the single countries. So this was complementary, I think, very well.
Great, thank you so much. Okay, thank you, Claudia, Teresa, and Howard. I know you're recovering from COVID, so thank you so much for being with us today. I think COVID is having another wave all across Europe. Many people are sick at the moment with the cold that has come across. So thank you so much for being here and talking about your experiences with the Rapid Exchange Forum. Okay, so then we will move to the use cases and the federated data analysis. So as presented in the video at the start of the session, we have 4 use cases which looked at COVID-19 questions and also tested how we can do federated analysis. So let me welcome Martin Thyssen from the Robert Koch Institute in Germany. Can you tell us a bit more about what these PHIRI use cases are and which research questions were addressed? Thank you.
Yeah. Thank you so much, Petronilla. Good morning, everyone. Yeah, it's my pleasure to talk about the research use cases of the PHIRI project, because I think it's a really nice group exercise that we conducted within 18 months with a short period of time. So it's worth going into detail into the results especially. But let me start maybe for the colleagues that are not aware of what the PHIRI use cases are, make it a little bit the frame for the use cases. And as you all know, that there are many indirect effects of the COVID-19 pandemic that affects health through various pathways, including secondary consequences on health and well-being due to, for example, delayed prevention, diagnosis, and medical treatment. And within PHIRI, we wanted to look at four use cases measuring the impact of COVID-19 on population health and furthermore demonstrating how a broad variety of routine data can be pooled and used for secondary analysis, of course, in a distributed way across Europe, as Nick said at the beginning, without data moving or leaving the data holder's premises. And these are the two aims, basically. The first aim is, and that is where I'm going into detail today, is the focus on the research. We conducted research through these 4 use cases of immediate relevance on the consequences of COVID-19 on European population health to ensure a better understanding of the impacts of COVID-19 in specific subgroups and risk settings by conducting these use cases, and provide in the end, and that's what we are doing now, the verified use case analysis results, focusing on the comparison, on meta-analysis and comparisons between countries in Europe to provide actionable outcomes to guide policymakers in preparedness or response scenarios. And these results, as well as the use cases, they are published now on the Health Information Portal, which is great. So feel free to take a look at the site. It's very nicely set up. So in the second aim, but this is where Enrique will go into detail a little bit later, is that these are pilot activities for the benefits and added value of a federated research infrastructure by bringing together data from different European countries and feed them into a federated research infrastructure. So, and this is basically a great opportunity to share the knowledge that we gained and the expertise, the lessons learned, developed across Europe for capacity building reasons. We need capacity in these processes. And this is an important point when we look at the sustainability of PHIRI as a cornerstone of future activities like the European Health Data Space for secondary use as the data hubs, so-called data hubs in PHIRI that are contributing with their data to the use cases, will be health data access body within the EHDS too. So that's great. So okay, that's the frame. Let me go into the use cases quickly. And we have 4 different use cases. The first use case was about the direct and indirect determinants of COVID-19 infection and outcomes in vulnerable population groups with reference to inequalities. Following the research question, if the COVID-19 pandemic has changed existing patterns of non-COVID-19 healthcare utilization for vulnerable populations within and between countries. What we did is we compared age standardized utilization rates for each month of 2020 and, if available, 2021 with pre-existing trends before the pandemic from 2017 until 2019, and supplemented by ecological analysis on the comparisons using data on infection and hospitalization from ECDC. So, and the outcomes were heart attack, stroke, hip and knee replacement, as well as serious trauma admissions. We had in this use case by now, we had 5 data contributors, and the results are just 2 bullet points because the reports are all published on the Health Information Portal. For more details, feel free to take a look at it. A drop in hospital discharge rates was observed during the pandemic in all countries, but differing by condition and month. Socioeconomic differences also varied, but by condition. And our evidence suggests that periods of more severe policy measures also correlated with more dramatic drops in regular hospital activities. The second use case deals with the COVID-19 related changes in delayed care in breast cancer patients, answering the research question if there was any delay in the treatment of breast cancer due to the COVID-19 stringency measures. So, and the included were all women over 18 years old with a diagnosis of breast cancer that received hospital treatment, for example, surgery, radiotherapy, chemotherapy, and so on, from January 27 to December 2021. And the outcome was is the time from breast cancer diagnosis to the first treatment, in this case, surgery. And there are also 5 countries involved in this use case. But when I say that's the status quo, we have more countries that intend to provide data within the future, but there are some like data accessibility, so it takes some time for other countries and other institutions to join. And what we can observe regarding breast cancer delayed treatment, that there was an acute decrease in treatments just after March 2020 in all the countries and regions that participated. And there are changes in the trend of time to first treatment in relation with the surge of the COVID-19 cases in March 2020 in some of the participating countries. The use case C is the third one, is called use case C. And this is a special one. It looks at the impact of COVID-19 on perinatal health inequalities. And the great thing about this use case is that we have on board an already grown and well-known research network, which is taking lead in this exercise. That is the EuroPeristat network. So we are really able to show that our federated approach that we follow is not just working with the PHIRI participants, but it also can be adopted and scaled up for research use cases and their participating institutions. So that's great to see. And the research question was if the population indicators on maternal and newborn health were affected by the pandemic. So, and then the changes were assessed in perinatal outcomes in 2020 using population birth data in Europe and compared preterm birth, stillbirth, neonatal death, and cesarean delivery rates in 2020. 31 countries and regions are involved in this use case. As you can see, that's a lot of countries, that's a lot of data that coming together using our approach. And the results are that in 2020, and we didn't expect that, there was an unexpected decline of preterm birth in some countries. We didn't expect that, while there were increases in stillbirth and cesarean occurred in other countries. And we have a high level heterogeneity that suggests that some government policies to mitigate the pandemic might have been more protective for pregnant women and newborns than maybe in other countries. And last but not least, we had the use case on mental health. That's the fourth use case, and it provides insights in COVID-19 related changes in population mental health and if the health status, depression and anxiety of the general population changed during the pandemic. To do so, we used indicators such as prescription of antidepressants and anxiolytics, visits to primary care or specialist care with an episode of depression and anxiety, and using electronic health records. And in this use case, we have 6 participating institutions, and the result is that there was a decrease in diagnosis of depression and anxiety and drug prescription in 2020 in the participating countries compared with the pre-pandemic status. So this is, in a nutshell, the results of the use cases, what the use cases are about. And I want to say thank you to everyone, especially special thanks and foremost for the data hubs that provided that data, for trusting in what we are aiming for and trusting our approach, and to really exchange the lessons learned that you experienced. That is very valuable for us. So
thank you, Martin.
Thank you so much.
That's really great. I actually have a couple of follow-up questions. So it's interesting. I'll go not chronologically. I'll call from the bottom back to the to the last, because the last thing you talked about was mental health and a decrease in diagnosis, which is really interesting because on Monday last week, the Health at a Glance was published, and I saw an increase of almost 50% in use of mental health issues. So this is something how does this relate to the findings of the use case?
Yeah, this is also a question. It's about interpretation of the results that we found. Is it a lack of care of specialists in this area? Is this the reason that we see this development, or is it the data year? As I said, we compared it for 2020. How is the situation in 2021? Maybe it has changed because of this. By the start of the pandemic, maybe people weren't that eager to go to specialists, and maybe some depression symptoms developed over time in the course of the pandemic. So it's all about interpretation of the results, and we need more insight and more meta-analysis on this, because these are the very first results, and we need some more in-depth analysis to maybe explain these differences to other studies, and in more time, in a bigger time period, and more maybe participants to really show.
Maybe that also really nicely aligns, because I would assume, I mean, we could see from the cancer use case that it was like the number of diagnoses decreased as well, because obviously there was less availability of the health workforce. So I would assume that this would be exactly the same case for the mental health.
Exactly.
use case. But so I think that's quite alarming, because if diagnoses are decreasing, but if we can find through, for example, surveys or other methods that mental health is really decreasing, I think our results are quite important to take into consideration for future policies, especially regarding mental health. Then I have just one final question for you. So you've talked about the Europeristat use case in which 31 countries have actually been involved. I know that Europeristat before used to work with Excel sheets that needed to be filled in very heavily, and that now made use of the technology that we have suggested through these use cases. What do you think are the main benefits of actually using this type of technology and bringing research networks together in a research infrastructure like PHIRI to facilitate this joint analysis?
Yeah, that's a very important point, and that's what I said. That is why it's great we have the Europeristat network on board, because we can really show the added value of our approach, and we got feedback from them. It's actually not my thoughts. It's the feedback from the participants of the Europeristat network that it really helps to speed up processes and harmonize approaches, harmonize in terms of metadata, in terms of communication, in terms of exchange data through a common data model, answering a research questions without data moving. So this is really, they really appreciate that they are part of it, and then that they can adapt, that they have the possibility to adapt our approach, because for their own processes in the research network, it really helps to innovate, and also the lessons learned for other research networks, of course.
Thank you, Martin. I will actually invite Enrique and Pascal and Andrea to join us already on the floor, because I think they have a lot to add as well, especially Enrique, Bernal Delgado from Ajax, who is our key expert on having facilitated this work on federated analysis. So Enrique, could you maybe share your take on what is federated analysis, and what are really the benefits and the challenges for working through federated analysis?
Hi, Vitamina. Hi, guys. Hi, everyone. And let's congratulate first for this second anniversary. And excuse my voice today, by the way. Well, in plain words, in the end, is work cooperatively in different places. You can take this as we should, for example, we can repeat the same tasks, all very well coordinated, or we may say, well, let's hand over some tasks to one node, some others to other node, and then at some point in time in the future, we end up having the work together. So federated in the end, as we have different institutions, different groups working for the same goal, either repeating the tasks or doing different things that will be joined at some point in time later. So this is more or less the idea of federation. And why a federation? Why not using the same way that we are so used to? So collecting the data in a single place. Well, in the end, there are, in general terms, there are two big reasons. One is that it's so big the size of the problem that we have to partition the problem in pieces. So, for example, it's not the case, but if we were for a research project that is big data, real big data, then we need parallel computing. So, doing things that we are not so used to in a single place. Or we will need to partition the problem in different pieces and allow the others to run the analysis. But as I said, this is not the case for PHIRI. The case for PHIRI is because we are dealing with sensitive personal data. So we are not going for the retrieval of open data to do research. We are going for individual data that is sensitive. But we want this data to be linked at some point in time between data and data sources, even more sensitive. And we do need to make the most out of that. So we, in the end, decided keep the data in their own jurisdictions, using the not just the overarching regulation for Europe, GDPR, or the regulations it affects, but also the internal regulations of each of the institutions, the organizational rules that drive the curation and maintenance of the data. So this is why we opted for a for the federated thing.
Thank you. And you didn't really touch that much on the benefits and the challenges. I mean, you were actually hosting a help desk, so you got a lot of the questions from all the participants across Europe. What were some of the main challenges that you saw within the countries to be able to do this federated analysis?
So the most important thing is that doing things federated requires more interoperability, an effort, an extra effort on interoperability. And don't think of semantic interoperability or technological interoperability that are also important things. It's also about how to make things legally interoperable. So compliance, let's say, with the principles of security and privacy by design, for example, or make things work together, or organizationally speaking. So, and then so this effort requires, for example, as you said, Petronil, and also mentioned by Martin, you need a help desk. The option for us was having a federation with a coordination hub, let's put it that way, and then this coordination hub taking the lead on a number of tasks, agreed with the rest of the nodes of the federation. But this type of organization, this back and forth, should be implemented at some point. And then one of the challenges is who at the other end should be in charge of this of this coordinated effort. Whether the capacity at this end, we have to think that there may be public health institutions that are big enough to have all the skills, all the capacities in place, or very small data holders with every capacity in place. So this effort could be at some point overcome using a help desk, and that is what we did in the end. So the capacity at the other end, the skills at the other end is a very important challenge. This is why we developed the IT Developers Forum, so to speak. And this is why we set up a help desk as well, with enough capacity to respond to all the queries that we coming up from the different places.
Yes.
So yeah. Good.
I can't echo what you're saying, Enrique. I think really building up the capacity in the countries is really what we need to do, especially what will be coming up with the European Health Data Space. And I think what you said with regards to semantics, it's very important as well. And I will bring in Pascal here because semantics has been very important in Belgium as well. Pascal, could you illustrate?
So good morning, everybody. So I'm so happy to be with you and to report with Martin, Enrique about the achievements. We've learned a lot running the 4 use cases. And one thing I can say is the interaction with the data holders is very important so that we can understand their concern. And for instance, there's always, or sometimes there's a misunderstanding about what is federated analysis. And what I can say is the spirit, how we operate with PHIRI, it's with the spirit of open science. And this is very important to build the trust. So you will discover that we are sharing all our methodologies through Zenodo, for instance, which is open data repository, where DPOs, for instance, they can understand what is the methodology, the analytical pipeline that PHIRI is using. And this is absolutely key to be transparent, to explain our methodology. And we are at a point where we are very happy to be able to share so that the community, the DPOs, we can discuss with their bioinformatics department and see how we approach this idea of federated analysis. And in many cases, we were successful because we were able to discuss with the stakeholders and to showcase how we proceed.
Thank you, Pascal. So before going back to you, Enrique, maybe I could ask Andrea to comment. So Andrea Faragallis from the Istituto Superiore di Sanità in Italy. Could you maybe share a bit your experiences of participating in the PHIRI use cases? How was the experience for you?
Hello to everyone. Could you hear me? Okay, thank you. May I share my screen because I prepared some slides. Oh, this one. Okay. Can you see it? Yes. So I'm Andrea Faragalli. I'm going to present the testimonials from Italy inside the use case. I'm the IT expert for the Italy. I'm from the Polytechnic University of Marche. As you know, we participate to the use case via two institutions, from the Italian Institute of Public Health and from Polytechnic University of Marche. So we have two different experiences. The first one, I provide remote support to the Italian Institute of Public Health to install and deploy the Docker. In this kind of study, the first one, the use case A, we have to install and deploy the Docker on virtual machine. During this phase, we faced some technical issues that we already discussed with developers, and we use anonymous data that is accessible by the Italian Institute of Public Health. From the other side, we have access to regional data, so via the collaboration with the Marche region, we have access to the regional data via specific procedure. We have to construct the final dataset by linking several secondary administrative sources, obviously according to the GDPR. In that case, we have to install and deploy Docker on a Linux dedicated machine. So we have experience in installing and deploying on a virtual machine and also in a Linux dedicated machine. And we run the Docker with the Marche regional data for the use case B. What about the challenges that we already discussed with the leaders and the developers? The first challenges for us is to get access to anonymize the hospital discharge record. So to do it, we have to apply for the study to be included in the National Statistical Program. The other point is just technical about the model setting. So we think that more specific error warning message should be provided because we faced some issue inside the analysis by performing the analysis. Also, in the second use case, in use case B, we have a long time required for building the final data set before it is proceeded by the Docker. The case definition, we think that should be the same across a research infrastructure and developed on the basis of secondary sources used. Also, more specific error. But this one, these challenges, issues are already discussed by with the developers and the leaders. So obviously we have also the added values. So we built a strong international network because we have a strong interaction with the developers and with the leaders. Obviously, the second one is that all procedures conduct to a standardized results reports, and these reports, these results could be comparable internationally. And we think also that administrative health databases used in federated research infrastructure can help European stakeholders to support shared decision making in a health crisis.
All right, thank you so much, Andrea, for sharing your views. And I think I can also, from this, I heard from the colleagues from other users as well, was that it really saved them a lot of time, especially in the context of the Europeristat. Instead of having these Excel sheets being collected individually, if we can actually broadcast and use this federated, huge time effort that you are winning, and also the elements that Enrique already discussed about being GDPR compliant, privacy, security, and so forth. So Enrique, let me come back to you, because I think we are, with PHIRI, we're really piloting and we have showcased what can set the stage actually for a lot of activities in Europe for the future of federated data analysis, and more specifically the European health data space. So what do you think are the lessons learned from PHIRI that can be taken up in the European health data space?
Yeah, you're right. And actually, Martin mentioned already that a big chunk of the partners in PHIRI are actually what in the future will be health data access bodies or data holders within the health data at the European health data space for secondary use. So this PHIRI thing is showcasing at some point how to generalize a model, a working model, a working outflow for the different actors that want to do research with sensitive data and population health research, policy relevant questions, for example, as we demonstrated here. So as I said, PHIRI is demonstrating the workflow that is generalizable to any other question of interest. This is on the one hand. On the other hand, we could say that we have been setting the basis for the mobilization of sensitive data, because there are, for example, now the debates about anonymized data, pseudonymized data, de-identified data. One of the big insights in the PHIRI use cases is when we define the data model, the data schema that takes some time to agree across the nodes. The reason why we do this is not just because of semantic interoperability, it's because we want to go for minimized data. Don't move more data than needed in the end. This is one of the big principles in the GDPR, and one of the principles that's behind all the discussions on the identification. And then we might also say that, for example, using this Docker thing, we are providing with a way forward to secure the process. We are now listening about secure process environments all time, or trusted research environments all time. Well, this is very much thinking of building, capacity in the data holding, the health data access bodies for the researcher to access a secure place to run the analysis. But the Docker in the end plays the role of a secure environment as well. So we are providing alternative choices for the decision makers to use secure environment, not just setting up a huge infrastructure. So I would say this is very much what we are actually providing: methodology, ways forward to be compliant with the ELSI principles, legal, ethical, and societal in principles, and providing technological solutions for the deployment of the European health data space for secondary use.
Thank you, Enrique. And before going to our last question, I will ask maybe Pascal. We have put some of our outputs of the use cases on the Health Information Portal. Could you show us and demonstrate us this on the portal, Pascal?
Yes, I'm going to share my screen with you. Okay, sure. So, okay. So here I'm showing the Health Information Portal. Since a couple of days, we've got a new section. If you look here, we add find data sources, find publication, find European initiative, and we've got a new tab, PHIRI demonstrators, and I am on the page. So Martin was explaining us what was the 4 use cases, and we are happy to share more information about the 4 use cases on the website. So we've named this section PHIRI demonstrators. And here, for instance, if I go to the use case on impact of COVID on vulnerable population, we provide a lot of information about the use case. So here you see the research question, the core description. We've got also the history about the activity concerning the development of the use case, because it's a lot of about coding the analytical scripts. And we have also published here one example of the output. So as I told you, with PHIRI, we go for open science, and we have provided to the community virtual labs where the users, they can access the script and reproduce the scripts using synthetic data. So really here, the idea is to share our activities, our knowledge, our scripts to the community, so that, for instance, a country can candidate and do the same as an analysis as what we've done so far in Europe. So, for instance, if I go, so we provide the scripts in 2 different environments. Data scientists, they have their habits. Some of them, they code in, they are working with Jupyter Lab or RStudio. It's different working environment. But from the website, we provide them a playground so that they can use our code and reproduce the analysis for real. So for instance, I'm going to open, so to show you how it works, I go there. So you see here, technology, it's virtual labs on the cloud. So we provide an access to the virtual labs. I've already opened 2. Okay, it works. So it goes fast. Yeah. Okay. I'll show you. This is the session with RStudio. So our script is there. We've got also the synthetic data, which is available. So I've opened it. If I do the execution of the script, I'm going to be able to produce a report in real time based on the use of synthetic data, which is provided to the community. So here you've got an example of the use case A. And as a data scientist, everything is transparent, everything is available. I can go through the scripts, review them. I can check the common data model. So here. So this is all about open science, reproducible science. We provide 2 flavors for the virtual labs. There's RStudio or the Jupyter one.
Okay.
That's it.
Thank you so much, Pascal. I know there's other plans as well for our colleagues across Europe to be able to make use of the outputs that we are producing in PHIRI. Enrique, could you tell us more about what's next? What are some of the upcoming plans and what you foresee for the future?
Yeah. So first of all, it's very a practicality. So you will have available the app. For those of you that are used to R code or Python code or Jupyter notebooks code, etc., is okay. You can take this as Pascal mentioned and just download it and reproduce what we've done. For those of you that are not so skilled on these tools, you will have soon the actual application that we have used. As a live demo that you can download yourselves, and you can replicate the same use cases that we have developed here with your own data, if you will. So this will be in the very short term, but in thinking of long run, we are thinking of scaling up now and make this sustainable in the end. Scaling up means doing preparing for more queries, more research queries, preparing for more complex research queries, and preparing for more people interested in doing research using our methodologies. So, and this is our effort right now. And thinking of the long run, thinking of how this PHIRI infrastructure could, let's say, prevail over the timeline of this project and go further and cover the needs of the population health researchers. And for that purpose, let me announce, we have been working internally in a white paper in Work Package 7, but now this white paper will be open up to more public consultation and discussion with you guys. So this is one of the big steps. And the other big step is that you might have seen, this would be in the timeline of this project. You may have seen that those that you practiced already the development of these research queries, we have used the humans most of the time, the interaction between humans. But if this makes much more sense in terms of sustainability, in terms of things, doing things more efficiently, we now need to use more machine-to-machine interactions. And then we are working also in how to interact with the different research networks in the future and the researchers within our project using machine-to-machine interactions. Actually, Miriam mentioned earlier about how to get the information out of the health information portal using machine protocols. This could be the same thing. So yeah, but keep in mind the long run is on this white paper, and we will ask you all for your feedback. Thank you.
Thank you so much, Enrique, and thank you also to Martin, Pascal, and Andrea for sharing your experiences working on these use cases in federated analysis. I think something we haven't mentioned yet, but the health information portal has been built in such a way that it doesn't solely focus on COVID-19, but it provides support to researchers in population health research and also for policymakers in the long run. And we will maintain the portal even if PHIRI, I mean, we will continue with PHIRI in one way or the other, but the portal for sure, even if there are gaps in between projects, we will keep it up and running, because the way we've designed the portal is to make sure that the elements that are provided on there are independent of the actual topics. And this is the same case for the use cases. The idea of the use cases is to be able to reproduce them regardless of which research question is being asked. So thank you so much, Enrique. Then we will move on to capacity building and technical expertise. So on the health information portal, we have also a really rich area about training and capacity building. So you can see here that you have an area which says training, you have an activity catalog, and a European school and health information. But of course, we have also our experts around the table who will be able to explain us more about that. Luis Lapau from Portugal is here with us. Luis, can you tell us a bit more, please?
Good morning, everyone. Thank you for the invitation. As has been said this morning, we need to cope with the resilience. We need to have more resilient information systems, as well as we need to tackle the challenges of European health data space. So it means that we need proper training for health professionals. And as COVID-19 pandemics show, there was a great demand for capacity building. Therefore, we in PHIRI, following the previous work in INFACT, we established a one-stop shop for capacity building based on metadata catalogs and to provide a lot of information, integrated information from different perspectives, but also including information from other partnerships we have been establishing with WHO, OECD. So we can find in the portal information about courses, webinars, workshops, and conferences. Most of the training are organized by WHO and the ECDC, but also from PHIRI. PHIRI has a contribution about 10% of activities that are shown in the portal, in capacity portal, as well as one can look for the topics on the determinants of health, health status, information systems, and it's the coverage of the information regarding capacity building addresses both Europe and the world. It's about 50-50 from Europe and 50-50 and other 50% from the rest of the world. These are the main things that we could find.
And how about this health information school? Can you tell us more about what the health information school is, who it is targeted for, and what are the main topics?
Yeah, Health Information School has two aims. First is to share information about what will going to happen in the next year. But at the same time, we are preparing a winter school on health information systems for younger population health researchers and policymakers, so we can interact and learn the basics of population health information systems. At the same time, it will be a one-shot to show the results of the PHIRI, the many contributions from the different work package from PHIRI.
Okay, great, thank you. So maybe then I will ask for Henk to join us as well. So Lois and Henk have been working together to lead the activities of capacity building. Henk Hilderik is from the RIVM, the Netherlands. Can you tell us a bit more about the trainings that you, together with Lois, have organized with regarding to foresight?
Yes, good afternoon. We have been organizing a capacity building course on public health foresight, and maybe explain a little bit more about what foresight is. It is understanding a bit what are the most important trends and developments in the future. And of course, if we want to be prepared for the future, we have to be understanding better what kind of trends in the future are there and how we can anticipate those trends. And actually, if we want to support policymakers, policymaking is about the future, so we should understand a bit better what is important in the future. And Foresight provides a methodology to address those trends, but also the uncertainties obviously involved in when we are looking to the future. So something that we were doing in this course, first of all, we wanted to know what kind of capacity is already there on foresight methodologies in Europe and beyond. And we wanted also to understand a bit better what are the needs for capacity building. So we did an inventory for that using desk research and a survey. And based on those inputs, we developed a rather extensive course on public health foresight. And that course consisted of 5 different modules. One was a basic level, to a more advanced level, how to really do a foresight study. So, and those videos are also available within the Health Information Portal.
Okay, thank you so much. Also, another training has been provided by our colleagues from the Institute Salud Carlos III. So Joao, I will ask you, Joao Forjas, to join us as well from Spain. So in your work package, you're doing important literature reviews, and you've organized support also for training there. Can you first explain us what kind of training you gave, and then tell us more about this literature review? What was it based on, and what were the results that you can share with us?
Sure. So I'm going to share my presentation where I have some photos. Let me just a minute. Share my screen. Okay. Now.
Oh. Perfect. Go ahead.
Okay. So, I'm sorry. Just a minute.
It was there, but it disappeared.
Okay, yeah, I clicked the wrong place. So I'm going to do it again.
All right, there we go.
Now? Okay, good. So, so we did a lot of literature reviews. Actually, what we wanted was to summarize the research evidence in several aspects related to COVID, such as what are the research pathways that are being used, what are the indicators of direct and also indirect impact, what are the associated factors or determinants to short and long-term COVID. Also, what has been done about digital tools, and also about an important indicator, which is disease burden. So we had a lot of teams working on all these aspects, mostly doing literature reviews, and we wanted to share with the broader community what we have learned about it and and also how we did it, right? So we did a workshop in October, 2 months ago. We did a workshop online about learning from journals and literature reviews of COVID-19 research. And we had, this was online, we had a more theoretical presentation by Daniel Caldeira, who showed us some of the principles of literature reviews. And then we focused on experiences. So we wanted to see how to tackle the road bumps or the difficulties, how people who actually dealt with the difficulties, and also we wanted to teach how to do it through one online tool, which is the Ryan. So the goals of this, it was during one morning, and the goals of this workshop was to identify the stepping stones of literature review of population studies, and to share the experiences by working with a collaborative group and how to do that, how to do in peer review process, how the difficulties of defining the PICO criteria, and also how to collect information. And we finished this workshop with exercise with Ryan. And actually it was a very nice, we had 47 participants from lots of countries such as Belgium, Finland, Germany, Greece, Ireland, Italy, Latvia, Luxembourg, Norway, Spain, United Kingdom. And it was very pleasant then to go to conferences and people will tell us, oh, I actually attended your workshop and I really learned from it. So here we have some of the feedback, and we also, Teresa, who presented before, she did a great job in disseminating the results and the announcement of this workshop. We did more than that. In February, we did a seminar on digital innovative tools about contact tracing in public health, and that was led by Luis Lapau. And here are some of the speakers. We talked in that seminar. We talked about the role of digital innovative tools in public health, the perspective contact tracing with Lara Mas from University of Bremen. Mariana Peralteo talked about the overview of contact tracing in Europe. And finally, Marcel Luis from University of Lisbon talked about contact tracing modeling. And in March, April, end of March and beginning of April of 2022, we had, this was a face-to-face workshop, a 3-day workshop about COVID-19 disease burden in collaboration with the cost action. So the main goals were to introduce to burden of disease assessment using COVID-19 as a case study, and there were 20 participants from about 15 countries, so it was a great success. And people actually enjoyed, they said it was a nice experience, a great opportunity to explore synergies between the PHIRI network and the European Burden of Disease network, which is something that's always present in PHIRI, to outreach to other networks or institutions. So here are some of the photos. You can see that we did group work and a nice family photo at the end. So I'm going to stop my presentation.
Thank you so much for sharing that, João. And then maybe content-wise, could you share a bit about, or just explain in your own words, what the literature review is that your work package has carried out, and maybe if you have some key points that you want to share with us.
Yeah, actually, it's very hard to say it, because it was the work of so many people for so many months. And so we had a workshop in EUFA, the European Public Health Conference, and we were there for 2 hours to explain, to give a proper answer to your question. But one of the things that came to was that digital contact tracing is useful and is cost effective. The other thing that's important is that both multimorbidity and frailty are important outcomes, but there's a lot of studies about multimorbidity, but not so much about frailty. The third one is that there's a large variety of direct impact indicators, and of course, severity and mortality have been the most one that have been used mostly.
Okay, thank you. So I will then give each of you very short the floor if you can let me know what is next. So Louis, what's next? What should people keep an eye on for PHIRI?
Wait, I just put it on the chat. I think it's important to emphasize that PHIRI and WHO have been collaborating a lot on infodemics. I think you can find in the portal a lot of information about the trainings on infodemics. I think it's very important in this time of this situation of pandemic. And the next will be so we keep on updating the portal on capacity building trainings, so everyone can go there and see the news about the new capacity buildings. And we are organizing in next March a winter school on health information. Will be a five-week training, just 5 days, and with a lot of work and with contributions from different experts from PHIRI and other organizations.
Great, thank you. Henk.
Yes. Actually, what I was mentioning before, that the Foresight module that we have been offering to about 70 participants from all different member states, and based on the capacity that we have built, now we have 10 case studies of people doing their own Foresight study, and they are currently being done actually, and in January they're going to be presented, and I think we will also try to publish them on the portal as well. And of course, what we are doing, we are supporting as well those participants doing their own Foresight study with particular tailor-made sessions that they can really go in depth in doing a Foresight study, what's all about, where we can support them. And we also want to see how we can use the insights that we have gained from doing these Foresight studies, but also in general, how we could link that to policy making in a stronger way. And also, what is the information about future trends and developments that policymakers also need? And that could be also something interesting to explore, how we can include that in the health information portal.
Very much looking forward to that as well. Joel, what are you still working on, and what is still left until the end of the PHIRI project?
Yes, well, we have retrieved a lot of information about research pathways, and now we are summarizing. That's one. The second one is, as the pandemic has evolved, now the direct impact indicators are still important, but we also have to start thinking about the indirect impact indicators. So that's what we've been doing. And the third one, and linking with what Henk just said, is the importance to link research with policy making. So we want to summarize information not only from literature reviews, from the scientific papers, but also from policy and what actually has been done in the countries. And actually, the PHIRI provides a very important network with so many countries and so many institutions providing information of that. So we have two surveys. One survey has already been done, and we are summarizing now information from other surveys about policy and what has been used in policy.
Okay, well, thank you so much, Louis, Henk, and Joel. And actually, I will pick up on that last note of you, Joel. Indeed, the networks are really important. And that's why in the last section of this 2-year event, we want to talk a bit about the European dimension. So we have Chaim Rafalovsky from Israel, from the No Fear Project with us. We have Tina Brunner from WHO, and we have Christian Wimmer from the Health Emergency Preparedness and Response Authority. And indeed, in FIRI, we thought it's really important to actually collaborate with different projects, with different organizations and institutes across Europe. And we've put quite a bit of emphasis to be able to do that. So I would like to ask each of the panelists, what was your experience and added value of collaborating with FIRI? So Chaim, I will go to you first. Could you tell us a bit more about the Prepare cluster and how we've worked together?
Yes, first of all, thank you very much for the invitation. It's an honor being here, and congratulations for 2 years of a wonderful project. Secondly, No Fear project is about creating a network. This is the objective of No Fear, and it is about the better connecting those who are involved in acute care of patients in security-related incidents, the academia and the industry. And this is how we started. And I would say that the Prepare cluster at the beginning was very far away from our radar, because it was perceived as, okay, these guys are dealing with public health. We are dealing with security-related incidents, so we are different areas of healthcare. And then the pandemic struck. And we realized that a public health emergency becomes the largest, most complicated emergency in the healthcare sector in the last 100 years. And we realized that we need to bring together the healthcare professionals on both sides, on public health and on acute care of patients. And that exchange is extremely important. And to be honest, critical care people are rarely involved in public health issues. We see the results. Let me put it this way, normally if public health fails, acute care people intervene. If they manage to prevent the outbreak, they vaccinate, they do our other measures of prevention, and they're successful, we don't even know that it happened, and we don't see the patients. And here it was a very different situation. We had a situation that was evolving on a daily basis, and we needed that exchange. We needed the flow of what we called quick and dirty information from public health to clinicians back and forth, especially because our patients were evolving. The way we treated them changed, and we had to look at it from different perspectives. Just to give 2 very small examples that I would say saved lives, and people are not aware how much this interaction saved lives. One was the idea that in the very beginning of the pandemic, we were ventilating everyone. The idea was the normal way of treating a patient in acute respiratory distress. If your saturation is low, we will ventilate you. And then suddenly we realized that the outcome of the patients that were not ventilated, that were delayed with their mechanical ventilation, is better. So we had to go back to the people who are public health, but understand more the virology behind the things, and ask them, does it make sense? What is the impact on the lungs that makes this disease so different? And when they said, you know what, there is a point, maybe we could try other things, and we improved the outcome of patients through preventing ventilations or delaying ventilation. The other thing is that I'm a paramedic and I've been trained all my life, treat the patients, not the monitor. So if I look at the pulse oximeter and it says that the patient is saturating 92%, and the patient is smiling, I would say, okay, I have a malfunction in my pulse oximeter. The patient is okay. In COVID, it is not true. In COVID, they are smiling and they die. And what we call the happy hypoxia or the silent hypoxia was something that the scientists brought to our minds as clinicians, as those who treat patients, and said, in this case, you need to start treating the monitors. Or in a way, it's not the truth, but the idea was if a patient is showing low saturation of oxygen on his pulse oximeter, that patient needs to go to a hospital and be treated, and don't leave those patients at home because they will die. We didn't measure how many lives we saved, but this kind of interaction between networks, between different aspects of healthcare showed us how important, and this is why there are so many people that even don't know that they should be so grateful to prepare about these exchanges. And we admire people that real time, in the middle of the worst situation, took the time to talk and exchange things. And I think that this is the remarkable thing, that people understood that it is not the kind of event that let's wait for 2 years and then talk about it, but we will sleep an hour less, but we will exchange. And this is admirable. Thank you.
Thank you so much, Cam. You're giving me goosebumps because I think you really are hitting it on the nail. We really need to work across sectors, and you are giving a very, very good example of where it has actually had a direct impact. So I think we really need to keep that going. And of course, a crisis situation is a bit different than I would say a normal situation, but there's so much we need to learn from each other, and by bringing all the different facts together, you really get a better picture of what needs to be done. So thank you so much for sharing that experience. I think it's really providing a very clear example of this added benefit of working together across sectors. Tina, could you maybe share also your experience on what was the added value of working together?
Thank you, Petronil. And also, I'd like to join in congratulations for 2 years of this important project. We worked together in the area of infodemic management. It started first with sharing experience, which was extremely important, not only with the awareness that we in the European, but also in the global, across the world, needed to be dealing with mis and disinformation and countering it during the pandemic. But it also became very clear very early on that expertise from people that work in health information, in digital health, and all related aspects of evaluation, etc., was really, really critical in enabling us rapid generation of evidence for decision making when it comes to understanding what people are concerned about, what kind of questions they have, which data sources potentially we could use for this, and then what kind of interventions that we use. So we literally, the last 2.5 years, leapfrogged not only in Europe but also globally. And I must say that the connections and the networks that we've been able to work through PHIRI enabled us much faster exchange of experience, both at country level, exchange of expertise. So we started first with this, but very early, also European experts came in into our global trainings, promotion of vaccine demand, for countering of the infodemic. And now there's several collaborations and several projects that where European expertise is very much part of the work at the global as well as European level. So not to really underestimate the fact that PHIRI network and collaborations existed before the pandemic. We were able to leapfrog in this challenge much faster and respond much faster than we could have ever otherwise. And I do think that the collaborations that we've established are something that are going to stay going forward. So I really need to thank all of you and particularly your team for really being open to working with us on this area of work, because it's not necessarily just about communication and communicating health information, but really much bringing in also systematic use of data to address different kinds of analysis that are needed in order to respond to health misinformation and disinformation.
Thank you, Tina. Stay with us because I do want to ask you one more question, but I want to give the floor first to Christian. So Christian, could you also share your experience of working with PHIRI from the perspective of HERA?
Yes, thank you, Petronil, for inviting me to your second anniversary. And when it comes to experience, I would like to recall that last week HERA celebrated its first anniversary. This means HERA is much younger than PHIRI. And this brings me more into a forward-looking attitude when dealing with such a senior organization that has settled a long time ago, while HERA is still in the process of recruiting people. Of course, HERA got considerable momentum in spring, but recruitment is ongoing. So let's put it a bit in a perspective. So the mission of HERA is to strengthen Europe's ability to prevent, detect, and rapidly respond to cross-border health emergencies. So cross-border health emergencies is more than COVID-19. It's more than epidemic, pandemic. HERA has carried out a threat prioritization, and beyond emerging the viral diseases, antimicrobial drug resistant has been recognized as a silent pandemic, and also CBRN, so chemical, biological, radionuclear threats have been identified. So HERA takes a wider approach, but focuses on to address. You still hear me?
We just heard your voice was off for a second. You might have touched your keyboard, but now we hear you. So please continue.
Now?
We hear you.
Yeah. Well, I have the impression a cable is broken in my headset.
No problem. We hear you.
So let's. So the approach is to make available and provide access to key medical countermeasures. So medical countermeasures are defined in a wide sense, include medicines, medical devices, diagnostics, and all that toolbox. So and HERA takes a comprehensive approach, so supporting the development, basic research towards medical countermeasures, but also the clinical trials. Also look into supply chains, so medical countermeasures production, also be prepared for a crisis phase, procurement and stockpiling. So this is quite a wide range HERA is addressing now with regard to the medical countermeasures. I mentioned there's the crisis phase, which includes the procurement, but currently HERA is operating in the preparedness phase. And among the many activities that are relevant or are pursued in the preparedness phase, I would like to focus on the threat assessment and intelligence gathering. So this is where HERA is currently developing an IT platform. So we have a budget of 73.5 million euros for anticipatory threat assessment and response. So anticipatory, so these are very different pillars of that IT system. So the anticipatory threat assessment is basically our personal goal here is that the next pandemic we don't learn from reading the newspaper, but it's the commission that based on work done in HERA and ECDC and all the wonderful colleagues we have to to be the first to detect and allow even an earlier reaction than otherwise. The response element is that I mentioned already, we look into the supply chains to also be prepared by assessing vulnerabilities of supply chains. Now, in this context, so particular when it comes to the anticipatory threat assessment, what HERA plans to do is not to reinvent the wheel. So we are well aware of many activities that are ongoing. We are, for example, in touch with the WHO hub that is also has a global ambitions for threat assessment like HERA. We know that many systems have been set up in member states, so interoperability is a very important, so that we even have a budget line of also 2-digit million dimension in order to enable this. And within this context, we see a strong potential also to include the data resources PHIRI has set up. So it's we had already one meeting where we looked into what your planning is, what our expectations are. I mentioned this is work in progress. So the IT system to set up the platform is a major challenge to bring in an architecture that has added value, is interoperable. So this takes time, but PHIRI is definitely on one of the important sources which we will consider when setting up this architecture. So that's from my side more the forward-looking approach. In the end, we the two of us, we are still quite young.
Thank you so much, Christian. So hopefully for many more anniversaries ahead. So then I will invite Tina, maybe Taim also to come back. Tina, what do you, in terms of infodemic management, what do you think will be the future and the activities for the PHIRI network to watch out for?
Actually, there's something already this week that we will be reaching out to you in review of rapid evidence synthesis and infodemic insights reports and other tools that we can use very quickly in order to respond to questions, concerns, infodemics in our populations. And also really looking into assessments of preparedness capacities. This is something that can be done very quickly and where I think we can collaborate together, especially to get a reality check or a bit of a truth checking from all of you who work with policymakers and within public health. And of course, there will be a lot more collaboration, I think, that will be needed also in exchange of experience, but also contributions and participations in a variety of capacity building activities. I think there's quite a lot, and I really do look forward to working with the network next year.
Thank you, Tina. Chaim, what are your views? What do you think are the challenges that we will have to face in the future with public health and crisis management potentially?
First of all, I would start with infodemic. And I think that we have here a huge issue, which is a strategic threat, and we cannot undermine it. And we will need to have a very high-level discussion about the boundaries between civil rights and infodemics. Because in many aspects, we are trying to deal with the technical aspects, which is true, because we don't have at the moment the right tools to identify infodemics early enough to be able to deal with them before it's large-scale fire. But at the same time, in our understanding as No Fear, it had such an impact in the response to COVID-19 that we will need to have also the legal framework to deal with infodemics. And there is a thin line that is still to be discussed between the right for an opinion or challenging and spreading rumors that you know that they are wrong, that they are not the truth, that they are lies. And I think that has been crossed during pandemic, and it is still a discussion. So politicians will give us the tools that we will be able to fight the infodemics. But I would like to finish with a more positive note. One of the things that we realized during COVID-19 is that public health especially, but health professionals are not always well integrated into crisis management structures. And crisis management structures are not used to the way health and public health work. Just to give a short example, in crisis management, we take a decision and we expect to see results within 36, 48 hours tops. In public health, you take a decision today, and the best case scenario, you will see a result in 7 days. And you need to teach decision makers about this time frame, about the idea that they cannot change their policies during those 7 days, because if they change policies, we restart the timing and we start to have counting again 7 days, and that they will have to brace, even though the numbers are rising, to see what is the impact of the decision. So this is one hand of things. The other hand is that senior healthcare professionals get to their point, to their position, without any training in crisis management. So it is very difficult for them to go into a crisis management meeting and adjust to timeframes and to the idea that the mayor has an hour for the meeting, because in 90 minutes, she or he have a press conference, and never mind what you say in the meeting, after an hour, there will be a decision because it has to be communicated in 90 minutes. This is not the way healthcare people work. So we need, and I hope that through the new mechanisms in the European Union and the European Commission, we will be able to train both sides, the decision makers and healthcare, and integrate better health into crisis management.
Thank you so much, James. Thank you so much, Christian, and thank you so much, Tina, for having shared your views and for having provided concrete examples of how collaboration is really key. And indeed, with PHIRI as well, we've really made the effort of improving this interaction between researchers and policymakers. So that being said, I'm gonna first, I would like to thank everyone that has been here today, all the speakers, and everyone who has supported the preparation of the meeting, both in my team here, but also in the PHIRI family all across Europe. It has really been already 2 amazing years. I know it's been in a very critical and a difficult situation where we have had to work, but also I feel like we've been able to achieve many things, which you can see through all different activities. So I really want to thank everyone for having put so much effort in making PHIRI operational and delivering such qualitative output. I really look forward to our remaining activities till the end of October. We still have time to do a lot of different activities, and also, of course, let me take the opportunity to already wish you a very good holiday season that is coming up. And we will be having our General Assembly on Friday as well, so we'll be meeting some of the colleagues there as well. Thank you so much and have a wonderful afternoon.